it's Scott. And what we're going to go ahead and touch on in the next couple of minutes is really just two things. The first of which involves the essentials of epinephrine. The second of which is how stopcocks, especially for little kids that have an IV, are your best friend. So when you're trying to figure out how much epi when it comes to kids, couple ways to figure that out. First of which, if you take your PD wheel, if you dial in the age of the kid and you follow epi across, it'll tell you 0.03 milligrams. Now that's important because that tells you milligrams. On the PD wheel, because of space, there's not that much space, they don't tell you how many cc's you have to push. Now, when it comes to the Broslow tape, if you take a baby who weighs 4 kilos, you put red to the head, measure this kid as gray or 4 kilos, it'll tell you milligrams, but more importantly, in parentheses, it'll also tell you 0.4 cc's of epi. And if you look on the Broslow tape, it tells you epinephrine, but then underneath it, you remember, it also says epinephrine ET. That, remember, is huge. That's if you're putting it down the endotracheal tube. Now, remember, for several years, drugs down the tube don't work any better in kids than they do in adults, meaning we're happily for several years getting away from routine epinephrine down the tube, especially in cardiac arrest, but the books still talk about it, so it's still on the tape. Same idea applies when it comes to Hantebi. Remember, in the book, if you follow epi down, you'll see epinephrine ET and you'll see epinephrine IV. However, as several people have brought up in our labs, what's interesting is if you look in the book, the epinephrine ET is in red. And that makes your eye go to it. That's important because instinctively, many people say that's what I should give. That's not the case. Now, why this comes into play is when we're dealing with a little baby who only weighs 6 pounds. So a normal, cute baby who requires epinephrine IV. The epi dose is going to be 0.3 cc's. Now, why that's a problem is if you just take this and you say in a little baby, give 0.3 cc's, that's going to be challenging. Because on the side of the epinephrine, it's got little tiny marks, but to try to figure out with any sort of confidence that it's 0.3 cc's is going to be way too challenging. So here is a totally cool trick that I learned from the pediatric ICU nurses upstairs. And when they have a kid who goes into full arrest, one of the nurses' job is to go ahead and prepare the medications. And when it comes to epi, stopcocks are your friends. So if I want something to go to the patient, I turn it off to everywhere else. If I want it to go into a syringe, I turn it off so that I create this angle. And if I were to turn it this way, then it's not going to go anywhere. And what they'll do is just take the amp of epi in a little baby. Let's say the dose is 0.3 cc's of epi. All they do is off to the patient. Then they'll go ahead and pull up dose number 1. Dose number 2. Dose number 3. So that way, literally within less than 30 seconds, we have our first 3 rounds of epi. If it were a bigger kid, let's say that weighs 30 kilos, and we have to give 3 cc's of epi, all we have to do is exactly the same idea, take our stopcock, and now we just draw up multiple 3 cc syringes. And if we have a couple of doses pulled up, it's just a quick, easy, and very safe way to have the correct hit of epi.